stream off my phone. But basically, I'm Daisy Frankcombe. I'm one of the general surgeon. Oh dear. I'm one of the general surgical team at Campbelltown Hospital in southwestern Sydney. Still experiencing some internet issues, unfortunately, but I'll persist on in the interest of time. So basically, my research was looking at serum biochemical markers in complicated appendicitis and the impact that obesity has on this. I'm really sorry, I just can't get my slides to work. I'm not sure if people can see this part of the screen. I might just go with that for now. So basically, a number of studies have been carried out which demonstrate that patients with obesity have an elevation in their baseline CRP and white blood cell count. This was, for example, demonstrated in a study in 2015 of 674 patients. And this study found that patients with obesity did have a CRP rise of 8.9 micrograms per litre with a range of 6.9 plus or minus either side. Similarly, in a 2021 study of more than 10,000 patients, it was found that patients with morbid obesity had an odds ratio of an increased white blood cell count of 5.1 for men and 4.7 for women. This was even higher for CRP in that men had an increased odd ratio of 13.4 and women of 19.2. Why this is important is that CRP and white blood cell count are known to rise with the degree of inflammation in appendicitis. So we expect higher white blood cells and CRPs in patients with complicated appendicitis. A study was conducted in obese children back in 2013. It looked at 947 patients, 164 which were deemed to be extremely obese. So had a mean weight of greater than 2 standard deviations above the mean weight for age. And this looked at the study in a different way to what I have, but basically they found that children with a high BMI had 25.6% of these children included in the study had a normal histopathologically normal appendix post-appendicectomy versus 10.8% in children with a normal BMI, despite having elevated inflammatory markers. This relationship hasn't been looked at in adults, and this is what my particular study aims to do. I guess what the clinical relevance of this is that CRP and white blood cell count are important indicators that we look at when we're looking at patients with appendicitis into how urgently to expedite their treatment, investigations, and their ongoing management. So the method used in this particular study, it was a retrospective study, and we looked at patients who, consecutive presenting patients who came into our emergency department from the period of January 2020 through to June 2021. From their electronic medical record, we collected their demographic data and biochemical data. An analysis was done with a Mann-U Whitney test as the data was not normally distributed. In terms of the results, as you can see, the median age of obese patients was much higher than those with a normal BMI. This is presumably because we didn't have an age discriminator for patients presenting, and we collected people ranging from an age of 7 through to being greater than 70 years old. And it's expected that there's a smaller cohort of patients who have obesity in childhood. In terms of the median BMI, as expected, the BMI of those in less than 30 was 23.6, and those with a BMI greater than 30 was 36.1. The rates of complicated appendicitis were 59 out of 223 patients in the non-obese group and 24 out of 83 in the obese group, with a total of 306 patients included in the study. With regards to patients' inflammatory markers, those with a BMI less than 30, there was a significant difference in CRP and white blood cell count for patients with complicated and uncomplicated appendicitis, as shown in the table here. However, in patients with a BMI of greater than 30, it was only CRP that was shown to be significantly elevated. So white blood cell count had a p-value of only 0.12, whereas the rest of the p-values were significant. So what is the implications of this? This study demonstrates that, unlike the study that was done in children, that CRP is actually potentially a reliable indicator in discriminating which patients do and don't have complicated appendicitis, and it can have a bearing on our future clinical decision makings for these patients as to who needs more urgent further investigations or theatre. However, this study demonstrates that white blood cell count in obese patients may not be a reliable indicator of complicated appendicitis. The study also showed that patients with a normal BMI, we could use both CRP and white blood cell count to make decisions about whether we think a patient has complicated or uncomplicated appendicitis on presentation. It must be noted that there are some weaknesses in this study. So patients in the obese group, as I pointed out earlier on, did have an older age on average, and that's children were included this study, which may complicate the findings in that children are less likely to have comorbidities that impact their presentation. I think it's also worth noting that the number of patients included in the obesity group was much smaller than those in the non-obese group, and that there was still quite a small number of patients with complicated appendicitis and obesity. This limits the quality of this study. So the plan is to do further research and collection of data to try and improve the power. Another issue that we encountered was that there was a lack of BMI data recorded on a lot of patients. So in the 18th month period that we were looking at patients, 587 presented to the emergency department, but only 306 had BMI data recorded. So in conclusion, despite obesity being demonstrated to have a higher baseline inflammatory markers in patients, including both CRP and white blood cell count, CRP may be a reliable indicator in determining which patients do have complicated appendicitis. However, as noted, there are weaknesses in this study, and further research and data collection should be done in order to further analyse this relationship. There's no conflicts of interest to disclose, and these are the references that I've used.
Thank you for that, Daisy. We'll take some questions in from the chat box. Tess, can you please read them for Daisy to respond to?
I can see them. The first question was, what is the timing of CRP measurement? So the CRP was managed on presentation to ED. Now, there was a variation in time from symptom onset to presentation to ED. The impact of this is yet to be analysed, but it's something that we're thinking about doing in future analysis of the data that we've collected. So as you've questioned, was it affected by time to presentation? Quite possibly, but that's not something that we've analysed at this point in time. I think that's it.
Thank you, Daisy. Any other questions at all, just please put them in the chat box as we continue. Next